Ooh, let's make this better.
Do you want to turn the light off?
I think we're okay. You guys can see? Yeah. Cool. How long has everyone been working at Equinox? Like, who's been working here for like 1 year? 1, 2, 3, 4, 5. 5? 5. Nice. Nice, nice. All right. Okay, so today we'll be talking about nervous system lens to changing pain while training, not just lower extremity, but also upper extremity. I forgot to change the title for that, so sorry. So introduction, my name is Jay. I was a former personal trainer at Equinox Chestnut Hill, and I think I was with Equinox for maybe 5 years, and I continue our relationship up to this point. So I think it might have been like a decade now that I'm in some capacity working with Equinox. And I'm a founder of PhysioX, and we're a nervous system-based physiotherapy clinic centered around helping active people with persistent nagging pain. So less of the acute injuries, but more the things that come and goes and doesn't really have a rhyme or reason why it happens. Now for traditional rehab, it does pretty well for immediate issues like acute pain. So if you twisted your ankle last week, there's a protocol to get the swelling down, get the range of motion back, regain your balance, regain your strength, and you tend to do well. But for pain that's more lingering, pain that comes and goes out of nowhere, well, that's considered more chronic, and that requires a different approach. And guess what? That's the majority of people that you're going to see. And the story about how I got all started, my mother, she's an immigrant from China, and she developed chronic back pain from working years in a factory doing low-income labor, and I tried everything that I had to help her as a physical therapist, and nothing worked. So all the stuff I learned in school, none of that scratched the surface for getting her any kind of relief. So I took it upon myself to really try to learn other ways the body works. So I had to go find mentors outside of the US system. And what I found drastically changed the way I treat, and also was able to help my mother finally get some of the relief that she's looking for so she can enjoy her retirement. And from there, I looked into putting a lot of content on TikTok. It was 2020, so TikTok was blowing up, and I was just posting stuff on there. Some of the big things I post about is disc injuries, foot mechanics, ribcage mechanics, and how all of that contribute to how a person functions, not just looking at back mobility and things like that. And we got a lot of traction, and eventually I started to see a lot of clients from all different parts of the world. We helped over 100 people from New South Wales, India, to Alaska. So the brand had really reached some more international audience up to a point in 2020. The brand started to grow, and eventually we started our brick and mortar practice out in Needham, Massachusetts, and this is what our clinic looks like today. I'm not sure if you guys might recognize these folks. They are trainers over at Equinox in Chestnut Hill. That's Burnett, and that's Christina. All right, so the biggest discovery that I've found in my rehab journey is looking at the nervous system. Most movement happens at the subconscious level. The nervous system's goal is to keep us upright while getting us from point A to point B. And you can think about this like a GPS. You put in an address in your GPS, it's going to take you the most efficient way to get you to your destination. Now, if there's a highway, it's going to take you on that highway every single time. But when the highway's closed, it'll bring you through a bunch of side streets and detours, and we call these compensation patterns. Now, what happened is, all your past injuries, those are all roadblocks or detours that you will have to take. And they're usually less efficient, and they usually maybe cause some aches and pain here and there. Now, the difficult thing comes when you've been going on these detours on these side roads and never realized the highway had opened up again. So now you're stuck taking a lot of these detours, you're stuck doing a lot of these side streets. So that's why when you look at someone walk, everyone's gonna walk a little bit different depending on what type of compensation that they have in their body. So let's put into a more real life perspective. Let's say 10 years ago, a soccer player hurt the right hip. So the nervous system will come into play and say, hey, we need to protect this right hip. But we still want this person to continue to move and survive somehow. So what are we going to do? So what's the best strategy to offload the right hip? First, we're going to hike the right hip, like so. But when I hike the right hip, my whole body has to turn this way, so that wouldn't work. So next, we have to side bend the rib cage back this way. But now our head is poking out to the right, and now we have to side bend our head back to the center. And now we have our limp. So the body reorganizes itself to protect a certain structure. And these are side streets, not highways. And the right and the left foot pressure, they start to change. So if I'm hiking up my right hip, I'm going to probably want to go onto the outskirt of this right foot and move around. And even as my right hip gets better, maybe I never found a way to go back to planting correctly on my right foot. So what happens then? Now we hold on to this protect the right hip strategy for all the things that we do. So when we squat, maybe we won't squat perfectly down parallel. We might squat and go over more towards one side. And that feels normal to us. It doesn't feel like, oh yeah, I'm doing it. It just feels normal. But from the side, you're like, yeah, that's not really down the middle. And these movement patterns really change in a subconscious way. So you could walk very differently. You're going to start running very differently. And based on this, over time, you might develop some back pain. And then you go to your doctor, and they'll give you some back stretches. They do some core work. But if they're not addressing the reason for this back that's getting overloaded is because of what's going on down here in the feet, we may be starting to miss the big picture of how do we find solutions for this person. So what do we do about this? Well, we update the GPS. We help you find the highway again, so your movement can be more efficient. And when I say highway, when I say point A to point B, I don't mean having to go in the car and drive. Point A to point B can be as simple as being here and being here. There's lots of ways someone can mess this part up. If someone have trouble planting into the big toe joint, they might come here to here and they go this way. And if they go this way, that means our entire body has to reorganize on the forces down here, versus when we're down the middle, we can line up directly down the middle. So foot pressure is one of the biggest things that I look at when it comes to rehabilitation, because how someone plants their feet on the ground changes the type of muscles and joint action that happens throughout the whole body. So midfoot pressure is something I want all of you guys to become a bit more familiar with. I think everyone knows about pressing through the heels to get the hamstrings, to get the glutes, but we're not talking a lot about midfoot pressure. And why that's important? Because every time you take a step and propel yourself forward, you land on the heel, but you have to get to the midfoot to push off. And if you're squatting, you might be on your heels, but when you come back up, we should be pushing off the midfoot so we can get hip extension coming forward. If we push through a heel, we start falling backwards. And how do we stop ourselves from falling backwards? We might just have to extend our back a little bit more to stop doing so. So just having the concept and the knowledge of the midfoot's existence and using it, that can change the way your clients do a lot of work. So even doing like a lunge back and forth, instead of pushing through the heel, maybe as they come down, middle pressure, but when they come back up, push through the midfoot. So these are all little things that you can pick up just based on this small little thing right here. Distal stability equals proximal mobility. Have everyone heard about proximal stability equals distal mobility? We all learned that, right? I learned that as well in school. But as I continue on my path in rehab and performance, I find, yes, this is true, but I find this to be a huge missing link in knowledge. If you don't feel stable in your distal extremities, your nervous system will freeze your midline in order to gain more control. So if you go on an ice skating rink and you never ice skated before and you're very unstable on your feet, what do you do with your upper body? You freeze. Are you tight up here? Or is this strategy built to create stability where you lack in your distal extremities? So I want to bring in a lot more distal extremity work today for you guys to experience. Because once you have really stable legs, we start to see the midline start to free up and open. When we're really unstable, the midline cannot open. No matter how much you try to stretch this person, unload it. And guess what? All that matters is loaded mechanics, right? If you're feeling great on the ground, swerving around, great, but you still need to get up and walk somewhere. So we're gonna go straight into some exercises right now, because I love talking, but having you guys feel your body is also very important. One of the biggest weakness I see in a lot of people, especially those dealing with back pain, knee pain, hip pain, is a decreased low tolerance to the hamstrings. And when I say hamstrings, I mean the distal hamstrings. The biarticulate muscle, I'm talking about the one right here, not so much of the proximal hamstring. I'm sure you guys get the proximal hamstrings plenty through your deadlifts and all your hinging patterns, you're gonna get there. But this distal hamstring is what needs to happen when someone plants the ground, unlocks the knee, and propels forward in space. This distal hamstring is also what's needed to hold us stable when we reach down and touch the ground. Without that distal hamstring, people with back pain would not feel very stable. So if you have anyone who's dealing with some kind of back type issues, this would be an exercise that you can add very easily to their warm-up. And even for you guys, now you guys all seem really strong, some of you guys will struggle with this exercise because we just don't hit this muscle nearly enough. So Adrian, I'm gonna actually have you demonstrate, and then you guys would do the exercise afterwards. We'll go around and we'll give you little pointers to make sure you're doing it right and feeling the right things, okay? So, where do you want me to go? Yeah, you come right here. You guys can all see in this way? Yeah, is this angle better than that angle? Doesn't matter. Yeah.
Depends on which side of the room you're sitting on.
Yeah, sure, whatever. So you guys can move around. You guys don't have to stay in one place. All right, you can lie down on your back. So first thing I'm gonna have Adrian do is to put pressure through the midfoot right here, okay? So go ahead and press through the midfoot, perfect. Press through the midfoot. One of the things that a lot of people cheat with is that they'll press down, but they'll also push. So they're using a lot of quad versus actually getting hamstring. So when I say push, I tell people like a gas pedal, just through the ankle. And that's important because we want load transfer, coordinated load transfer. So when he pressed down through the midfoot, we will get soleus, we will get distal hamstrings, we'll get proximal hamstrings, we'll get glute, we'll get abs. But if this connection is lost, now we might be overloading other structures. So you're pressing through the hams, pressing through the midfoot, pressing through the midfoot, and when he does that, automatically he's gonna get a little bit of that posterior tilt. Not a forced one. So Adrian, can you do a forced one for me? A forced one would be, see how the stomach bulges up? That's the forced posterior tilt. And that's what most people try to do. We want the post tilt to come from the hamstring itself. So just press down through your ankles. Perfect, got it, back is flat. And I want you to lift your hips up just a little bit, right there. And that's it. Don't lift any higher than that. If he goes any higher, he's gonna recruit a lot of glutes and he's gonna miss all of this distal hamstring. Now this is level 1, not too hard. I'm gonna bring him through a couple of different levels, then I'm gonna have you guys go through all of the same levels, okay? So press here, good. Now what I want you to do is go ahead and just straighten out this leg. Good, and up a little bit. And how does that feel?
A lot of work through there.
A lot of work through there. And just make sure when they're doing this, big toe joint and little toe joint is involved. Because some of them will find that the big toe joint flies right off. Now you're getting a lot of peroneals, you get a lot of lateral hamstring, maybe IT bands. We want medial distal hamstring. And then come down. Good. So I'm gonna have everyone try that. We're gonna start off with the double leg version, and then we're gonna go through a single leg version on each side. And what we'll do is we'll just kind of go around and coach you guys since we're sort of a small group, which is nice. And I'm just gonna randomly go to someone. So I'm gonna have you bring it up a little bit more like that. Press through here.
Yep.
And press through here straight down into the ground.
Press
You feel your
through there
distal
like a gas
hamstring.
pedal.
Perfect.
Then
Good. Lift your
slightly
hip just a
lift
little
off
bit.
just like
That's
an
it. That's it.
inch.
You feel
just
that?
barely enough to fit
Perfect.
your
You
hands
just
or a
keep
credit
right here.
card
Keep right here.
with your hips,
You got the pressure through the
and then you
midfoot.
can hold. And you should
Got 'em.
feel, you're going to feel a lot
Got
of
the
hamstring
midfoot.
just in general, but you should
Got
feel
those
more
distal
biased
hamstrings.
towards these guys around the
Perfect.
back of the knee. Exactly. That's how you know you're getting it right.
Midfoot.
If you get other people
Distal
that, you know, if you
hamstrings.
try this and you get other people to be like, oh no, feel this all the way up to
How
my
we doing?
glutes, and not a
You
lot
got
here,
'em?
you know they're not
got 'em?
biasing these distal
Perfect.
hamstrings
Good.
well enough. So
All right. Cool.
probably heels to get a little
So-
bit more glute. Yep.
So we just did bilateral. Now we're gonna do unilateral. So I'm just gonna have you come down a lot more. So you're gonna get a lot more from this just by being lower to the ground. Okay, let's do right foot. So the left leg is gonna be straight.
Yep.
And then you're gonna press down,
Set yourself up.
right down,
Good.
and up. And see if you can hold it for 30
There you
seconds.
Press right down through
Just the
here.
midfoot right here.
Press right down through there.
Just the midfoot,
right down through here.
midfoot.
Feel a lot of work right there.
You feel that,
Yeah.
Lisa? It's just
Yeah,
all
you guys
right
probably
in
saw
here,
me
right?
shaking. You're like, whoa, it's
Perfect.
pretty easy. Tough
I'm gonna bring you
exercise.
down a little bit and bring you a little bit further away.
though. Yeah.
Boom, right here. Press
You
down
can come
right
down a
here.
little bit.
Mainly, or is that
Boom.
What's that?
like the Nordic curls, like the reverse when you're going?
Mm-hmm.
Those target the distal at all, or is that mainly?
Yeah, a little bit.
They do
Okay.
target the distal, but what you're missing is the implementation of the midfoot pressure, which changes the game. Good. How's that feel? It's pretty hard,
Tough, right? Yeah.
Like this is not an area most of us really train. And let's go to the other foot. Let's do the left foot. So left foot on the ground. You're gonna press down through your midfoot, big toe joint and little toe joint knuckle. Yep. And you come right off.
Yep.
Perfect.
Relax
Good.
the head a little bit.
You got it?
Yeah,
Oh,
so you
yeah.
want to throw, you don't
Yeah,
want to
you're
throw in like
cooking.
abs in there or anything
You're cooking.
crazy. Yeah.
You're a little close. I'm gonna bring you a little bit further away. Is that good? I'm gonna go right here for you.
How's that? You feel that?
Boom.
Yeah, looks pretty good.
There you go.
Any like side to side comparison difference?
This one's definitely harder, I would say.
Gotcha, gotcha. Yeah, looks
Woo.
good. Feeling that?
Love it.
Yeah. Sweet.
All right, good.
Nice.
Nice work. So, super effective exercise. I view this low grade for someone who might be older that needs just to feel it. They might not even lift their butt off the ground. And you will notice if you lift just a little bit, it's worth a lot. If you lift too much, now you're getting too much of the proximal hamstring, glutes, and you're gonna miss out on the point here. For sprinters, really important. For runners, really important. Why? Because we're coordinating the right exercise at the right time. When you're running, midfoot pressing into the ground, distal hamstring kicks on, pulls our hips forward. If we don't have this, boom, lock out the knee early. How are we gonna get forward? Throw our back to bring momentum forward. So biomechanically, this changes how we move. And that's just from the nervous system understanding that this muscle exists. Like before, this might be a side street. Side street. And then now we have the highway back. It's just gonna be smoother. I watch people's gait pattern change just from doing this one drill. Huge. Now we're gonna stack this on to a closed chain manner to have you guys stand up. So this is one of my second favorite exercises. It's the midfoot slouch. So this is excellent for people with back issues because what do people with back issues look like? They come to you and they're like this. They're like overly arched because they hurt somewhere that rounding their back is gonna kill them. And they'll sit like that, overly arched. And constantly they have this tension right here. And the back is doing all the work of the legs. If you can draw a ratio of work, 25%, 25%, 25%, 25%. Those people like this are probably doing 85%, 5%, 2%, 3%. Don't correct me on my math, but you know what I'm saying. A lot of back, not a lot of legs. So what this exercise allows us to do is to shut off the back. How do we shut off a muscle? We put it in length. That's it. We put it in length. And once the muscle's in length, it's not gonna have the ability to contract nearly as much. So this is what we're gonna do. We take this, you can watch me first, and then I'm gonna have you guys try it on your own. You're gonna bring this knee forward on top of your knee, and this is the magic. I'm slouching over through my ribs, and I'm slowly letting myself go down, but I'm keeping my knee exactly where it is. I go down, and when I come up, I'm gonna push through my midfoot, my big toe joint and my little toe joint as I stay slouched. This is important. As I stay slouched, keep the knee where it is. And I come back up. I'm getting distal hamstrings, I'm getting glute, I'm getting zero back, and I come right back to where I started. And here's how a lot of people cheat. They do this. People cheat by doing this. They go down, and then they come up, but they bring their weight all the way back to the back leg, and you lost it. And there's another way they cheat. They go down, they lock out the knee, and then the back did all the work afterwards. So everyone's gonna do this. Let's pick one leg. Let's do right foot in front. Right foot in front. You're gonna bring your knee on top of the toes. Good. And here's the magic. You're gonna take a breath out. So your ribs can come down. Keep your knee where it is and dive straight down. And I want you to pause at the bottom here with that knee bent. So when you're down here, you might already start to feel your glutes starting to kick on just from holding you up in space. Now push through that midfoot, keep your knee where it is, come back up like a rag doll. Yeah. Do not extend through your back and come all the way back up. You guys feel your legs working there. We're gonna do 3 reps, and I'm just gonna walk around and see how you guys do. So bring that knee forward, the back heel will come off. So you're gonna have 90% of the weight on that front leg. Slouch. Slouch down, good. And when you get to the bottom, stay there. Stay there, stay there, stay there. I want you guys to appreciate this bottom position. You feel your glute kicking on right now. Keep that on. Press through the midfoot, keep your knee exactly where it is.
Keep this knee forward.
Push, 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 and now you come back up slow, ragdoll, coming back to where you started. Good, 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 come back up. And we'll do one more time. Knee bend forward, slouch over, slouch a little bit more for the ribs. There you go. You guys are doing great. Stay at the bottom, feel that glute kick on, and then push through the midfoot, big toe joint, little toe joint, come up. Yes, sir. Good. Who got their glute work in there? Amazing glute exercise. Because why? We're putting the glute at length. The glute does what? The glute contracts in extension, external rotation, abduction. What we just did is to put it into length. We put them into flexion, adduction, internal rotation. For a muscle to experience big load, you put them into a big length. Like if you want to give a maximal contraction to the bicep, you bring it down to its maximum extension. So you want to do the same thing for the glute, except we're just doing it in closed chain. So if I go hip flexion, internal rotation, adduction, I put it down and I slouch over, that's glute. So what we do, we try to give muscles no choice but to contract. And if we understand closed chain biomechanics, we can apply this principle for everything. And we add the midfoot on top of it, and we're gonna feel a lot better. For those people who love to deadlift and use their back right away, great drill to do as a warm-up, or even as an exercise, because it's hard. You give them 3 sets of 5 of these, nice and slow, they're cooked. We're gonna do the left leg, we're gonna do 3 reps. You're gonna bring your knee forward, chest tall. You're gonna slouch. Do not let your knee move.
How far do you want our back foot? You want like really forward?
Baby step, real forward, real forward. Yep, I'm gonna go around. You can bend this knee a little bit. Keep it right there, don't move it, all right? Now go ahead and push through right here. Keep it right here, ooh, there you go.
You want the back leg like on our toe or like flat or?
This leg?
Yep.
Yeah.
Yeah, just like how you have is good. You feel your glute working right here?
Push to come up. There you go.
Cool, and then you push through
Yeah.
that
You lost a
midfoot.
little bit.
Keep that knee where it is, push.
Yeah.
So I'm trying to
Push through here. Come on. Come on up.
Mm-hmm.
Push, push,
Yeah,
push, push,
midfoot
push,
area.
push, 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 push,
Yeah,
push, push,
knee
push.
angle doesn't change.
There you
Biggest thing
go.
for you too, I would just say,
Good.
like, think about when you're going
Doesn't
down,
take
just
much.
round, like vertebrae by vertebrae, because you're
Yep,
getting like a little
perfect.
bit of a
Push
hinge.
right here.
See, like his, you got a nice like
Keep that knee where it is.
C shape here. You were kind of
Push,
just
push,
pushing
push,
back,
push, come
getting
on
a
up.
hinge.
Push, push,
So
push,
like
push,
let your
push,
neck
push, push,
relax,
push.
and now you can get a lot of this. Yeah, there you go.
Feel that one. Killer.
That's how you can shut off this whole back musculature here. Even
all
just
right.
letting your head drag, just drop your head.
Yeah.
Just like, yeah. Now start pushing up.
Oh yeah.
Yeah.
There's probably some other
Push,
biomechanical
push,
things
push,
that we have
push,
to do.
push. Yeah. It's hard for you. Yeah. But you notice a difference about instead of just being hingy like that and actually just getting everything around. Yeah.
All right. Cool. All right, so now you guys experience this exercise. Okay. Who feels different one side versus the other side? What's the difference?
I fully tore this hamstring a year ago, so I feel it more in the distal on this side.
Oh, okay. During the midfoot bridge? Makes sense. So if you have torn that distal hamstring and it's not fully recovered, I'm willing to bet as you run long distances, we're going to start some kind of compensation start to happen. Because this doesn't load, what do we do instead? Maybe we load very well here, and this one is more straight-legged. And now we have to do this to compensate for what's lacking here. So that's how we look at injuries, that's how we look at mechanics, and that's how we fix injuries and movement problems. You see how it's not as simple as, hey, you have a knee pain, let's work on the knee. There's a lot of things that we have to work at together. Who else feels really different from right to left?
Like a little bit, I would say. I don't know. I don't know if it's just like regular muscle imbalance or because I don't really have any serious lower body injury.
Cool,
But yeah.
cool. All right.
Just a classic, like, however you want to call it, rotated hips posture, where like my hip extension on this side comes off great. I feel my glute, just whether it's this hip flexor is stuck or my hips rotated down, I can't hip extend quite as much on this side. It feels like it's tougher to pull on this side.
Do you mind coming up?
Sure.
So we'll see if we can troubleshoot a quick one since we have a good amount of time. So
So
during,
if you do like the classic, like hug this in, you know, you lock your back
Okay.
flexion so you can drive up. This is like all glute. This opens up nice. This side I kind of like, I'm just limited, right? So
Yeah.
I can't get this up. I want to start here. I want to start arching my back to help get
Okay.
extension there.
are you saying you feel this limitation in the ragdoll?
I feel
This
this.
slouch.
I feel this is just a limitation I've been trying to like work on for the past 10 years.
So this is, so you weren't doing a midfoot bridge.
I did do it with the bridge. Yeah.
Can you show me the midfoot bridge?
Just right here.
Yeah.
Push down.
Okay, good. And do you feel the distal hamstring?
I do.
Okay. Now show me the other side.
So it's not like hugely pronounced here.
Right. And come back down. Now there's more to this. Like there's pelvic obliquity. There's a lot of things that we can do to help with this. But I want to just make sure you're doing these two movements right. So if I would bring someone further away and then press down through the midfoot.
But
You got the distal hamstring right there?
just push down.
Yep. Just pushing down right here. Got it?
Yep.
Now straighten out this leg and just raise up a little bit. Now raise the hip up a little bit. And that's it. And you feel this fire up?
Oh, yeah.
Perfect, good. So pelvic obliquity can be addressed through a same exercise because this hamstring pulls into that pelvic inlet. So by having this movement done equal in both sides, there is a chance we may start to see some of the mechanics return. No promises. This is just like a quick two thing, but I want to make sure that you're doing this one correctly. And then press down, press down, press down, press down, and then straighten out this leg.
Straight.
Yep, and straighten out. And you can put your hips down a little bit. And you feel the distal hamstring on this side.
Yep.
Perfect. Same amount?
Pretty much.
Okay, cool. And then I'll be interested to see how you do with the slouching one. Because if you really have that limitation, we might start to see some changes when he goes down. Okay, cool. Come on up. And show me your movement here.
Which side do you want to go?
Whichever side. We'll see both. Okay. Okay. And what do you feel here?
A little glute, a little hamstring, a little calf.
Okay. Yep, and push back up. And stand. Push, 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 push. Good, 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 good. All right, and let's do the other side. Is this the side you're having some issues with?
Yes.
This left side. So we can already see right away what's going on. Come on up. There's no slouching happening over here. So let me have you go bring your knee forward. I want you to slouch through your ribs more. So that way we can get this and then go down. Good. And how's that feel for you? Good. Now slowly push through that foot there. How's the glute on the left side?
Not quite there.
Okay. I'm gonna lift your hips up a little bit. I'm gonna lift your hips up in the ear a little bit. In the ear. Okay. And how's that? Okay. And slowly push back up. Push, 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 push. And now we're seeing some shaking. Now we're seeing something. Good. So there's a little bit of a rotation component in there. I'm gonna try that one more time with you and see if we can find that glute for you. Because this exercise is also opening up that back pelvis. But if he's not feeling that, it's all contracted, he's not gonna open it. And go ahead, reach down. And when you reach down, think about like you're tipping over like you're in a somersault. Yeah, there you go, there you go. Good, and bringing this butt up in the air. Good. Nice. What do you feel there? Just
knee is probably bent too far.
No, you're good. Stay right there. Just hang out. Don't even move. Put your head down. And just breathe gently. And I'll tell people this all the time. Breathe through your butthole. Because people would tense up. So I tell them that and they go, oh shit, I can just open this up now. And now there's more space. You okay?
I'm good, yeah.
You got the glute?
Yeah.
Perfect. Push back up. Oh. Good. How's that feel?
Good.
Good. So I wouldn't say, maybe that's not enough to correct this, the pelvis,
for sure.
but at least now we can give
I was
you.
probably a little bent too far here. Felt my knee as I got a little more forward into it.
Excellent.
Felt everything kind of kick in.
Excellent. Good. So I just want to show just a correction because a lot of your clients will have these type of cheats that they'll do because you just want to know what you're looking for. We want this glute to open up. We want that pelvis to go like this. If you guys are into biomechanics at all, it's called nutation and counter-nutation. We can have a nutation on one side and a counter-nutation on the other side. Who heard of these words? Okay, so a few of you already. So we can manipulate that through this exercise versus the not old, but most people do a lot of breathing, one side, blah, and it can get super overwhelming. But if you understand closure mechanics, just a shortcut that you can get there. So use this one a bunch and you can see some really big changes for a lot of people. All right, so we are going over to the upper body mechanics portion of it now. Before we move on, does anyone have any questions on the lower body portion of this? I know we just touched a few things. Sweet. All right, so Adrian, I'm gonna have you take over this.
Sweet. All right, so a little introduction about myself, guys. My name is Adrian. I am a former athletic trainer with the Baltimore Orioles. I did that for 6 seasons right out of undergrad. I'll tell you a little bit of the journey, how I got